Hi everyone, welcome. My name is Promise Odera Onu, and today I want to discuss something that relates to our women. I want us to discuss about cancer amongst women. Um, there are things that we used to overlook in terms of our health that right now has become very obvious to us that we should pay attention to them. And even though cancer affects both men and women, uh, yeah, I have Dr. Bayo here. Doctor, if you can send me a request, good. A friend, a brother, someone I've known for a long time, who is an expert in the subject matter to come and help us. Hi, Bayo.
I promise. Good to
Yeah.
see you.
I call you consultant now.
Uh, Bio is okay.
Yeah, so first of all, I would like to say congratulations. I don't even know which one I'm congratulating you now. There's been so many achievements.
Let's keep it low, please.
uh, I'm not surprised you want to be humble. But yeah, really appreciate your coming. I know he's been planning the works for a very long time. Um, Obviously, I want to use my page to add value to society, especially to where we come from. You've lived in multiple countries, um, and you're now back to the UK as well. So please introduce yourself so that if anybody wants to, or if somebody's listening either now or later, they can understand the value we are giving, based on who gave those information. So please introduce yourself.
Right. Thank you once again, Promise,
Yeah.
for the opportunity to be invited, let's say, for your podcast or
Yeah.
for
Yeah. Okay. Yeah.
right. Me, it's amazing what you are doing.
Thank
I
you.
must commend you for trying to use a platform to share your views for people. All right. My name is Audi Adebayo. I'm a specialist gynecologist. Uh, I have interest in sexual and reproductive health, and I've been doing this for almost 10 years. So today we'll be talking about issues relating to women. I'm sure I'll still have to come back here more to maybe later on
Mhm.
for that. But today I think our focus will be more gynecological cancers or cancers among women and things that we need to do to enlighten our women.
Yeah.
So
It's
that's
interesting. Two men are sitting and we're discussing about women. But yeah, thank you so much. For those who don't know, Bio has been practicing in Lut. It's called Lut, right? Yeah.
yeah.
So, and very well exposed, very well knowledgeable. Lived abroad, worked abroad, and back abroad as well. So yeah, um, first thing first, uh, there are things like I was saying that you don't usually hear about our people. Things you think are more, with the Western world or other. But then now we're seeing it prevalent amongst our people, and one of them being cancer, and then cancer amongst women, as we're going to focus on today. So, what do you think really changed? I know there are things like genetically modified food that people like GRV was advocating and talking about. Um, and then I don't know what else could be the cost, but the floor is yours. How did we get here that things like this are now very common? Although it's one of those ailments that people don't really share openly, but we know. I mean, you probably have more first-hand information than I do to know that people now have these issues more prevalent. So what do you think? What happened?
Okay, well, thank you once again. Right, so that we're able to get a good grasp of the topic, I want to narrow it down to two particular parts, which is incidence and prevalence. All right. So when we talk about incidence, that's new cases.
Mm-hmm.
Why prevalence is total number of cases that you have at a particular point in time. Basically, it's not that we are having more new cases of those cancers basically in developing countries as opposed to developed countries. But the fact that I will say that they are underreported at that time and people are not, getting to have it at a time when they can be tested for it. And of course, if somebody is not being tested for a particular case or condition, you even know that they even exist in the first instance.
Mm.
And if you don't know the cause of death, you just say that okay, this person is dead. The cause of death is unknown, so it can't be reported.
Mm.
So that way, you say that the prevalence is reduced in that particular point or that particular area. It is when that case has been tested and is confirmed that you can attribute the cause of death at that cause to that condition, and you say that okay, the prevalence is high in this particular region. One of the things that limits us in developing countries is screening, and one of these things is because we don't have the tools for screening of these cancers. For example, let me talk about cervical cancer, for example, which is the commonest, gynecological cancers in women, especially in developing countries. Screening test is very important for somebody to identify if a patient might end up having cervical cancer, and it's cheap, easily accessible, feasible, and easy.
When you say it's cheap, are you talking in context of the UK or Nigeria?
Well, even in Nigeria, it's still cheap. I think for you to,
How much are we talking about?
I think with less than 1,000 naira, you should be able to get a screening test done, and it's done once every 3 years. That you are doing the pap smear, you know, which is just a screening test. You are taking a swab around the cervix, send it to the lab to see if there's any abnormal cell growth there. And once you can see abnormal cell growth, before it run to get to that point of cancer, you can quickly catch the patient, counsel them, treat it, and they'll be fine. But in countries like United Kingdom, for example, those tests are free. So once you just move on to the clinic, in fact, they'll be calling you to come and do your pap test, come and do your screening test, so that once they identify that you have this kind of condition, before it even reach cancer or all those levels, patients will have been treated and to be followed up. You can see. So in that kind of situation, the prevalence of cancer will be reduced because
Yes.
you've already asked the process before getting to that stage at which is going to cause cancer or cause death.
Mm-hmm.
As opposed to our own client, where oftentimes, patients are not being screened and you only get to see them for the first time when they already have that cancer, when it's already in the stage at which you cannot help them.
Mm-hmm.
And those are the different kind of things, issues that that we see. So the screening process is actually the very important part in identifying those that are at risk. Once you can identify them, next thing will be for you to try and see how you can give the treatment that they need at the moment to prevent the progression of that cancer and increase their lifespan and of course their health and well-being.
Wow, thank you. That's your wealth of knowledge coming into play. I didn't even know, number one, they do survival tests in Nigeria. And two, it's less than 1,000 naira, which is very cheap. I can say that. I don't know how much they sell paracetamol, but for you to do a whole test for that amount, I think is considered as cheap. Anybody can agree. Yes, I can also attest to what you are saying because I've received letters from this house from my wife being chased up and to come and do smear test, which is another one for cervical screening. I'm also an IT guy working in the health field, so I know how these things work. They set up or we set up in the system some sort of flagging when it's due for us to invite patients to come and do these things. But then you have the difficulty that Nigeria has not digitalized their health sector, so it's hard for even hospitals to monitor their patients. We don't even have the idea of having like a personal doctor like GP, which is one thing I've suggested that Nigeria should have all the private hospitals imbibed as GPs, so to speak, so that everybody at least will be diagnosed by a correct a qualified doctor, because one of the biggest problem in Nigeria is misdiagnosis. So everybody thinks everything is malaria. If you continue after taking malaria, they will think it's typhoid. If you continue after typhoid, then they will call it poison, and the person dies and they won't do anything about it. So, but then if you can use all these private GPs and public hospitals and government offset the depth of you know diagnosis, then everybody can go and be able to buy those drugs. Then we can help the issue with um, diagnosis or misdiagnosis. So that's another way of looking at it. So we can say creating awareness will be good in terms of um, you know encouraging people to do the screening. Then the only problem I have with cancer is that it affects every part of the body. So if you tell somebody to go and do cervical, um, the person can do survival and think he's free, but he's not really cancer free. He could have it anywhere in the body. Am I right?
Well, the truth is that cancer is a silent killer, and basically, it's spread. So, which means that it might start from the leg. Before you know it, it's spread to the head. Same as cervical cancer, ovarian cancer, uterine cancer as well too. Usually they start from the localized region, and if they are not picked on time, treated, before you know it, they spread to the other structures in the body. From there, they become widespread to the body. So um, educating of our people and having a routine test, is very important in identifying this condition at early time before they turn to a stage at which it's difficult to treat. Because obviously, once somebody have a cancer, it's the lifespan expectancy is usually 3 to 5 years. It's already full blown. So basically, surgery really have limited role. It's basically going to be more of chemotherapy or palliative care. So the question is, before you even get to a point at which you have to resort to chemotherapy or radiotherapy or even doing a big surgery, it's something that is actually, you can detect on time, and prevent from even spreading at all in the first instance. Which still brings me to the fact that screening is very important. Just simple screening can go a long way in identifying people that are at risk of that condition. And once they're identified, they'll be triaged appropriately to the nearest, gynecologist, you know, and that will be it. But unfortunately, some cancers do not really have a particular screening method as
Mm-hmm.
compared to other cancers now, for example, that pap smear can help you to, screen, for it. Other things can be used as well. Some other cancers, there's no particular, screening modalities that you can use to detect those that might end up having that kind of condition. And that is why when you go for general checkup, there is, high index of suspicion by a doctor that he or she can tie one or two together that, okay, if this patient is urinating and is having blood in the urine, I might be thinking of, is it a bladder cancer? Is it a kidney cancer? Is something they can quickly try to see a urologist or a nephrologist. You can try to say. If somebody is complaining of recurrent headache every time, doctor, I'm already having headache every time. Once you see, your GP or your medical officer, he or she can tell you that, okay, for you to have a recurrent headache, can it be a cancer in the brain? They can charge for you to go and see a neurologist or neurosurgeon, where they will do is scan the brain for you and identify if there's anything there and treat it. So there usually some symptoms that people might present with, that you as a patient might not be able to tie together until you see a doctor that will now be able to channel you to the appropriate, specialist. Then they will take over from management and point of care. Same for breast cancer. There's really no major screening test for breast cancer, but simple thing as checking the breast in the morning after bath for lumps and all those things. Once you can pick that up, you go and see a doctor. He or she will refer you to see, the general surgeon or the specialist that deal with breast, which they might have to do a scan of the breast and examine you, take a biopsy, then they assure you that if it is benign, if it is not. No. So it's very important to try and voice out your symptoms and see your doctor, so that they can be like your middleman that will charge you to the respective, specialists that will now go ahead and do your test for you, so that you can actually pick up what exactly, is wrong before it turns to something that's difficult to manage.
Yeah, thank you so much for that in depth. So now people can check for breast cancer by, touching the breast and all of that. And then cervical is there could be screening. And I think there is also screening for prostate. Am I correct?
Well, yes, it's not really like a screening test, but it's just a test that is done to check the level of a specific antigen. You call it PSA. If it's greater than some values, I think greater than 5 or so, you might not necessarily have a prostate cancer, but at a particular age, you don't expect it to be at a particular value. Which, if you find it, then you have to send a urologist where they might do a biopsy for you of the prostate, and they will check if at all there's any issues with it. So of course it's like a screening test, but those values are not really specific, because so many things can make you to have increase in that value. If someone have a infection, that value might also go up as well too. So just because that value is increased does not really mean that someone have a prostate cancer, but it might be a sinister sign that some referral to a urologist and for them to take a biopsy. Then they cannot decide based on the result to tell you to let you know if it is cancerous or not cancerous. Do you understand? So sometimes even doing the screening test is not the ultimatum. It doesn't really tell you that someone will end up having a cancer. Even if the values are high, it's just a triaging to help one to, triage a patient and, do the necessary test and precaution, so that one will be able to identify those at risk and manage them appropriately.
Yeah, thank you. So is there anything regarding lifestyle that could help in terms of prevention?
Well, yeah.
Because if you say underreporting, because I mentioned genetically modified food earlier, which I know countries like Russia has banned, somewhere you've lived as well before. And in this UK, for example, there's a lot of canned food, a lot of canned products that has been preserved, right? So, just for example, I was doing Uber and I started with a surgeon. I was trying to, in fact, he advised me against even juice. Even juice. He was saying, why not get a machine that can blend fruits rather than drinking juice? And he said to me to read the ingredients of everything I'm buying, and if it contains some preservative, not to have them or not to take them. So is there anything in our lifestyle? Because we used to think whether there was underreporting or not, our fathers, grandfathers, or grandmothers lived longer than us. Or say, for example, they lived longer, they enjoyed their life in the village. And I think more to that point is because they probably lived around nature, they ate organic food. Now, organic food, you're in the UK, organic food is more expensive. If you want to buy organic food, there's few shops that sell them, like Waitrose and Marks and Spencer. But most of us will probably go to Lidl and Aldi that is cheaper. But they're not organic food. So organic food is more expensive. But our fathers and grandmothers and stuff, they probably ate organic food for free because they were living next to the farms. So in terms of lifestyle, what would you sort of advise, relating to cancer amongst women?
Right. Well, the truth is, choosing any lifestyle basically is going to go a long way in impacting one's else. And when I mean other lifestyle, it talks about the diet, kind of food that you eat, the kind of a drink that you take. Basically, we all know that so many times people have talked about smoking being a risk factor for so many cancerous conditions, from lung cancer, liver cancer, and so on and so forth. And of course, issues about diet, kind of food that you eat. People talk about the fact that you need to take diet that does not contain high cholesterol, because these are things that can also cause cancer as well too. Not even cancer, even hypertension and diabetes can also have issues in someone's body. Then having good exercise is very important. Taking a walk, jogging, strolling can also help to improve one's health condition. And as regard to other cancers, the uterus or the cervix, uh, having, is practicing safe sexual practice, use of contraception such as condoms to prevent spread. Because, for example, like cervical cancer now, 98% of the point of spread is from sexual intercourse, and this particular virus called,
So cancer is an STI?
you say?
Is cancer an STI? Can it be transferred sexually?
No, so it's not like an STI, but the fact that the culprit, that is the main cause of cervical cancer, has been attributed to a particular virus called HPV, human papilloma virus.
Okay.
And the only way one can get that virus is from sexual intercourse.
Okay.
So it is that virus that causes proliferation of the cervix and cause abnormal proliferation of those tissues for them to not get into cancerous stage, which means that if somebody is not sexually active, you might not even have cervical cancer. Or if you have one partner that is faithful to you, there's no chance that you have a cervical cancer, because that virus is only, I don't want to say only, but 98% of time is from sexually, unprotected sexual intercourse from a partner that already has, that virus. Then having sex with you, you might be able to get that virus. And if it becomes replicated in the body, of course, it's going to progress to cause cancer. Do you understand what I'm trying to say? So those are the things that one needs to know. And of course, choosing healthy behavior as well too will go a long way in improving one health. Going for regular checkup is very important so that we'll be able to identify those at risk. But there are some that it's quite difficult. For example, for those that have breast cancer, sometimes it's genetic. Even though you go for tests and it's detected, because it's in the gene, there's actually quite difficult of things to do. Why? That's sometimes for those that are at risk of having ovarian cancer or breast cancer, one can do a prophylactic mastectomy, which is to even remove the breast out of the equation for the meantime. Because if the breast is the one that's going to make someone to have that white breast cancer, once one has done the test, there's some tests you can do like ultrasound scan, MRI, mammogram. Then the called BRCA1, BRCA2 gene. These are BRCA gene. These are gene that one can do to detect if it's in the body. So for any woman that you don't
Mammogram can help detect breast cancer, isn't it?
not the breast cancer, but it can help to detect that this woman is having, suspicion of having a breast pathology.
Okay.
You understand? For you to detect someone having breast cancer, you must take a sample from the breast tissue, then you send it to the lab.
And there's no way to get that.
Yeah, so there's a way to get it. It's just to take a biopsy from the breast.
Okay.
Then you send it to the lab. Then the lab will tell you if it's cancerous or not cancerous. You understand?
It's biopsy, sorry. Is it like a milk?
So biopsy is like, imagine you having a lump in your
Yeah,
hand.
that's what I'm saying. How would they get it? Are they going to cut the woman open?
Yes. Just a small
Opening.
opening. Yeah, they have a special needle come out.
Okay.
You just take it in the needle. Then
Okay.
just a small sample, less than 2
But you don't want
centimeters.
somebody should not be doing that often now before they put holes everywhere in
Yeah,
her breast.
and that is why you are doing that screening method of mammogram. It's not everybody that you will go and be cutting open.
Mm.
That is why you are doing that screening test of mammogram, breast ultrasound scan. There are different scores that they use to triage women. That's why I said that all these tests are triaging tools that help to triage women that, okay,
I'm
based on
going to say, yes, land on your point, and I'm going to ask you a hearsay. Let me use it, a hearsay that is out there, and you can confirm or not if that's actually true. Go on, land on your point.
okay, yeah, so those screening methods are triaging tools that help to identify and triage women, all right, that might benefit from further procedures. You mentioned something about PSA, about the screening test for prostate cancer. It is not every patient that have elevated PSA value that I will take in for prostate biopsy. There are other tests that I will also do, prostate ultrasound scan, all right. I can also do a DRE, which is a test to check for the prostate, So if the value of the PSA is high, I did a scan. Scan is telling me that the prostate is also enlarged, all right. Then I also examined by myself. I felt that the prostate is also enlarged as well. Those are criteria that will be linking me that, do you know what? I think we need a biopsy for me to see if what is happening here is normal or not. Do you get what to say? So it is not every time that you just take a patient as well to the theater and then you want to take a sample. Same for breast as well too. There are also other screening tests that you will have done before you can, take a woman for biopsy. For example, if a woman has a breast lump, all right, and you did the scan, either ultrasound scan or mammogram, and you can see the lump, and the lump you are not quite sure of what it is. Either it's something that you should be, okay with, or it's getting bigger. So it's lump that started with just like a 2 centimeter. By the time the woman came for follow-up, the lump has grown to 4 centimeter. Even you yourself, you'll be surprised that you want to know why is it getting bigger, what is happening, is it hormonal, is it not hormonal, what exactly do I think is wrong? So that's my prompt to take a biopsy. Then when you take a biopsy, take it to the lab, the result comes out that, oh, look, as you done the biopsy, it is normal, it's no problem, then you'll be at rest. But if the result comes out and it's showing that, oh, look, this lump is already showing some early signs of, malignancies or stuff like that, one can quickly go ahead and do either a radical surgery to remove the whole lumps or the whole breast, and the case may be, depending on the advice by the specialist. Do you understand?
All right.
So, but the whole thing still boils down to the fact that screening modalities is very important. Identifying people that will be at risk of that condition, all right, and those at risk, they can benefit from a prophylactic surgery or treatment before it develop into the full-blown malignancy. For example, there are celebrities that I don't want to mention their name that had that breast cancer gene in their body. They went ahead to do a prophylactic mastectomy and ovarectomy, which is that they remove the breast and the ovaries because
Yeah,
in their
I think I know somebody in Samaritan or something like that. She mentioned it publicly anyway.
you get right. So those kind of case, you don't have to wait until it's now developed to full blown. Yeah, before you now go ahead and start looking for what to do to save.
And I've actually come across some women that said they don't want to give birth. And you probably don't know their reasons, but it could be medical.
Yeah, I mean, it's individualized. Those are
You think it's a choice thing. She say, "Oh, I don't want to have children," but purely because of the risk.
Yeah, and that's why people need to respect people.
The hearsay I wanted you to sort of either confirm or deny or no comment is there's this common knowledge out there that if you're a woman, men sucking your boobs reduces your chances of having breast cancer, and if you're a man, if you're active, then it reduces your chances of prostate cancer. I don't know how true that is, because again, I put the question up that how about Reverend fathers and Reverend sisters? They've all not died off because of cancer. So is it medically proven, or is it just talk?
All right. Well, the truth is, the people that gave that well, let's say assertive information. The question is, as a medical doctor and a scientist, our reference is always based on research and studies. How many studies have been done to show that this particular patient is because it's socially active, that's why there's no prostate cancer? Is there any study that they've done or they can quote? Because you can't just come and say that if you take this drug, you'll be well. There must be an evidence-based, approach to everything.
But like
because you can't just say that.
I think the medical field is the most. No. I think the medical field is the most. How do I put it? Like, you will hear somebody say one thing today, tomorrow another doctor will say, you can. So it's very. I don't want to use the word subjective, but there's different sort of. Like some people will say, "Oh, eat your food. If you're from Nigeria, eat Nigerian food." Some people will say, Nigerian food is more carbs. Don't eat carbs. Some people will say, "Don't eat." Like I was telling you earlier, I almost don't eat anything from the supermarket. Eat homegrown food and whatever. But then it's like different sort of advices depending on who is talking.
Well, the truth is, anybody can come and say anything that they like. But personally, I always love to go with evidence-based research. You understand what I'm trying to say? If there's no evidence to it, then it is not proven. Because you can just take a small sample within 5 people and say that just because these 5 people, they are doing this kind of lifestyle behavior. Some people tell you that, for example, they've linked smoking to lung cancer. And they will tell you that, doctor, my father smoked till...
I've heard that one a lot. My father still smokes and she's fine.
You understand? The question is, you will not ask yourself, how many sticks do your father smoke per day? Is it just
one? Even if he's smoking one per day, but smoke is 365, and then they survive to 90 years.
Yeah, so those are
even alcohol.
Yeah, but it has been proven that these are co-founders. Co-founders are things that, for example, I'll give you an example now, just to explain what co-founder is. If you...
When you say co-founder, I was thinking of the church you want to go.
No. if
once we hear founder, we think about church.
So when I say co-founders, there are things that are not necessarily the cause, but if you put yourself in that situation, you might be at risk. For example, if you're going to club, there's a high chance that you might start drinking or smoking, and from that you might be able to start smoking. You that you don't smoke normally.
I tell you now, Bayo, right? Yeah. I have somebody distant but still a relative, or a relative of somebody that I know, that is a sister. She lives in a nun. She doesn't do any of this, doesn't drink, doesn't smoke. She's actually a sister, a Catholic, and she had breast cancer.
Yeah.
So
yes, I told you.
This is why it's very dicey when we try to put lifestyle to the cause of this thing.
Yeah, that's why I said that they are co-founders. There are things that can trigger even if they're not there before, your lifestyle might trigger it from happening. Apart from that, it might also limit your immune system. If you're not living a healthy life, living a diet, definitely your immune system will be low and it's going to even give way. Just for example, now we all know that fine. Let me say UK is safe, relatively safe. Just because of that, don't you lock your door if you want to sleep at night. Just because you have security guard everywhere, people are yes, you have policemen everywhere. Does that mean that if you are going out, you won't lock your door, you won't do the right thing? Just so you say end up doing the right thing because you don't even want to leave loopholes for things, bad things to happen. So just because you felt that fine, my father lived to 90 years of age and he smoked, does not mean that you want to embark on that trip of start smoking as well too. So those are the issues that is being advised that living an healthy life will not only help, but it's going to it's not only this for you, but just only help to improve, you know, your health and well-being in general. So that's just where I can put. And of course, there are so many studies that have shown that they've done and they've linked, smoking to lung cancer, smoking to liver cancer, smoking to throat cancer. So many, So, but it's left to, as a doctor, you can only advise and tell your patient that these are the prevalence and incidence of people that end up coming down with this kind of condition. But we advise that you don't go on that lane. But the choice is for the patient to decide what he or she wants to do.
You are very right. Yeah,
And again, the follow up of patients again, because a patient might start, smoking at early age. Some might start smoking at middle age. Some might start smoking at later part of their life. So the question is, even when you say the father smoke, the question is, at what age did the father start smoking? Is it from when he was 8 years? Is it from when he was 40 years? So there are too many things that one needs to probe in before you can just make a certain decision that my father smoked and he didn't have lung cancer, he didn't have this kind of cancer. How many life year per smoke did he have before he died? So these are things that one needs to be very careful before. But personally, me, my opinion, I always want to go back to references. It's evidence-based, that on a study. This is linked to this. If you do this, you do this, then I think one will be fine.
Yeah, I mean, there's always that, whether it's 0.9% or 1%, that of course that will probably be an anomaly in any research, whether it be IT based, medical based, or whatever. So somebody that might be smoking might be doing every other thing well, maybe doesn't eat fufu every night, or maybe is not big on food. Somebody like me that is big on food might not be drinking alcohol or smoking. And then somebody that is drinking alcohol might not be smoking. And some people might be taking just weed. People might have different vices, but then how they do the other things might probably help them get to that stage. But how be it, like the surgeon I was speaking to says, even if you live to 60, how healthy are you? Or let's say your grandfather that was drinking lived to 90. How? Because not everybody that's alive is really, really healthy. Does that make sense? So some people might be struggling with so many things and taking so many drugs every night to be able to cope. That's really not a very healthy life. So if you want to be strong and everything, and that's why military people that have been to the military, who've done a lot of exercises, you see that they usually are very strong and they get to very old age. Excuse me. So your points are in order, and I definitely agree. Lifestyle does a whole lot. Nutrition also, the kind of food you eat organic food is very important. Eat mango instead of drinking juice. Although people will think juice is good life or posh life, but most of these things we think are posh are things that really draw us closer to the grave. All these alcohol, strong spirit, blah blah blah. Stay away from them. Actually, all the vices are expensive. Cigarette is expensive. People spend a lot of money on cigarettes. If you're a smoker, you spend a lot of money. Alcohol is expensive. Whether you are buying bottle £500, 500,000 in Azul in a club, it's expensive lifestyle. So for you to even do the right thing, it's even cheaper, more affordable to live and do the right thing. Say for example, Bayo, I'm a young guy in my middle age, 32 years. What should I be worried about in terms of all these tests? How many tests should I do in a year? Is there like a generic test I could do? Say, for example, to say, okay, I want to go in for MOT. and just once a year. Do me this test, do me this test, do me this. Because like you rightly said, there are people who are at risk. So for a young person, what risk am I to? Because what we've seen now is that there is an increase in young people even having things like kidney failure. I know we don't want to get into that. People having things like liver failure or having things like cancer. And these are not things that we are very common with. So in terms of a generic health of a young person, how many times do I need to say, okay, I think I am due for a checkup, whether or not I'm feeling well? Because, like you said, there is a diagnosis of something that is already there. And sometimes people don't really want to go to the hospital because it's not one of the nicest places to go, unless there is a reason, a cause. And like you said, cancer is a silent killer. So at one point, even if I'm okay or I feel like I'm good, let me go in and see a doctor and let him do me all these checks. And how many checks are we talking about? I'm talking about generically now. You're muted.
So sorry, I
Mm.
have so
I know it's always scary.
yeah. So well, the truth is, at least once you have an annual checkup, I think the NHS people have that, you know.
Speak to those in Nigeria. We here we are
Yeah,
fine.
yeah. No, and which still bring me to the fact that I hope that we'll get there in Nigeria, where you know, people will be able to afford health care just the way they have in England. Is I think we are too rich of a nation, um, you know, for our patient, our citizens to be suffering and not having the best health checkup. I think right now the doctors in Nigeria they're on strike,
Maybe
and
on strike now.
yeah, we're so grateful because these are things that I feel is unnecessary and it should not be a
But
luxury.
saying that even UK had their doctors on strike recently
No,
as well.
the truth is every country has their problem. That's the honest truth, and each country will find solution to their problem. That's the honest truth. I believe that. But we need to strengthen our health sector so that people because some deaths are just unnecessary. Like I said earlier, that most of this cause of these are things that are preventable. You will see people in developed countries live to 100 years, 105, 95. It's not logic. It's because of regular checkup. Just like you having a car and you are going for every year to check the is it MOT or so you are sure that this 1 year, what has been equal, I should be fine, you know.
Mm.
So at least routinely, yearly, one should be able to go for routine checkup, which also include blood pressure check, blood sugar check, kidney function test, heart function test, These are basic. Check the cholesterol, check the urine. If you can do all this, check the heart, the liver, the kidneys, the lungs, the blood pressure, and you are fine. There's a high chances that you'll be fine for the next 1 year. And if there's any issue, that will be a pointer. Because, for example, if you are a man and you go for a checkup, the doctor was able to pick up an abnormal value, he or she will triage you to see a specialist
Mm.
that will be able to advise you appropriately. For a woman as well too, you're going for regular checkup, ultrasound scan, a pap smear, a normal breast screening mammogram, which is done, at a particular age, ultrasound scan, won't be able to identify these issues at the early stage, I'm able to manage them accordingly. So annual checkup, I don't think it's too much to run these tests altogether. A full blood count to check the blood level, a kidney function test, blood sugar check, blood pressure check, and a general body examination with good diet and exercise. I think one should be fine. All right. So that's just it. But it's quite expensive, might not be affordable in Nigeria. That is why personally I hope that one day I will talk to some of my colleagues that are already, in power, how we can not you don't necessarily be to be in power before you can make a mark. Could give advice, on how we can reform our health system, achieve NHIS for people, even if it's just to do the baseline normal screening test for them. It's going to go a long way, from the start, and then hopefully one day we'll get there.
Thank you so much, Doctor. It's a very fine place to leave it. Just to recap, because I try to provide or profess solutions here. Everything rises and falls on the government. I mean, for us who are here, either working in the NHS or using the NHS, we are far more grateful for that, because they even beg you to come and do these things for free. They chase you down, they write you letters. I mean, my mom is out of the country, but she still gets letters to come and do a diabetic eye screening, because these things flag up on the system. They send you letters, they place calls, they follow you up. Now in Nigeria, we don't even have database of, we don't even have, everybody don't even know who is their GP. Probably people will know how to get to a chemist, and most of these chemists are quacks. Most people learn training, they train to become a chemist. They just know name of drugs and what they think is doing. And that's how people just get drugs, taking drugs for things that are not related to their ailment. And at the end of the day, they get into more complication, or, they even lose their lives. So, the Nigerian life does not really matter, to be fair, because everybody is like fending for themselves. The government does little for you, except you are rich. Government hospitals that are supposed to be affordable are not affordable anymore. You literally pay for everything. So we are calling on the government to do the needful. Even campaigns and sensitization. It's like, I think one thing that is very sensitized right now in Nigeria is BP checks. So everybody knows how to go and check BP. People probably have to. I think my mom knows how to do her own herself. So that one has been sensitized enough. But we need to sensitize lifestyle. And there's nothing big man about eating canned food. All this sardine, all this corned beef, all these things you are eating. There's nothing big man about it. Eat fresh food, fresh fish, fresh meat. All this, I don't know if you know about what they call our tomato. All this tomato that is already spoiled, that they buy cheaper. All those things, we need to stop it. Buy fresh tomatoes. Even the doctor told me to stop buying tin tomato that we buy here. The plum tomato that we buy here. The doctor told me to stop buying them. That she buy normal tomato, blend them. So all these things are good for you. And exercise. This country has a very, very good culture of gym. Nigeria, how do you go to gym? How many gyms are even in Nigeria? I was thinking the other day that all the hotels in Nigeria should be having gyms. Even if it's supposed to be a franchise. If I have the money now, if I have capital, I will go to at least every big hotel, have an area, even if it's one room, have gym. Because that's what they are doing now. In the UK now, they're not only having gym, they are putting saunas, and they are putting swimming pools, and they are putting in steam rooms. These things help the population health, and that's because the government care. So you can even pay as little as £50 or whatever, and you have free access to go to that hospital, to that hotel. You don't need to lodge. You just go straight to all those fitness facility and use all of these things. So these are things we need to do to encourage, especially our young population, people in universities. Our universities, for example, are supposed to have gym, all of them, free. We're supposed to encourage things like parks and stuff like that. Because it's three things. It's lifestyle, it's feeding or nutrition, and then it's exercise that will help your generic health. And then your yearly annual checks, as they call it here, comes in, whereby you do, like doctor said, you check your BP, you check your blood sugar, you check your kidney function test, which is checking all your kidney, level and all of that. Your liver function test. What's the other one you said? Liver as well. You can check your liver. Just 1 year. Check all these things once. And then if you're a woman, check yourself when you are showering. Press your breast and make sure there is no lump. Check for it. If you're a man, when you are showering, check your scrotum and see if it's the same size. Feel them. If it's painful, you go and see a doctor. These are things you're supposed to do for yourself. And then have an attitude of speaking to your doctor. Have a qualified doctor you register with. And even our middle class, because our middle class don't know that you're supposed to be doing this. They think they just need their money for weekend shayo and all these things. They don't have this. Need to encourage it. So thank you so much, Doctor. Any final words?
Just that I must commend you for what you are doing. I think it's great. Try to touch every part, and hopefully one day your platform will be a bigger platform. Rooting for you, and I'm ready to come anytime you want me to, moderate for you and help our people. So yeah, that's just it. Well done.
Well, thank you so much. Yeah, I've had Tolu, I've had you, so I'm hoping to have you guys back again. Maybe we can do a three-way one as well. And yeah, these are the little we can give back. Of course, we want to do more. If it was easy to go into politics, I'll probably be an essay or a commission and probably do more. I'm ready. I'm ready to serve my people if I'm called to. But sometimes you wonder what is really the reason why things are not moving forward in Nigeria. Because I don't believe they don't know these things. But let's just say that we're not there yet, and we're hoping that things will get better. All right, so thank you so much. I'm going to leave you. I know you are very busy, doctor, so thank you so much for coming. Appreciate your time, and my regards to the lovely family.
Thanks, bro.
All right.
Yeah.
Yeah, bye-bye. Bye.